Hi, good afternoon, everyone. My name is Crystal Sun, and I'm the Director of Healthcare Analytics at Civis Analytics. We're a data science advisory and technology firm, and we've been fortunate enough to be working with the state of Illinois and helping support their COVID-19 response. Thank you to the U.S. Chamber of Commerce Foundation for assembling this panel of presenters and inviting us to be a part of this event. We're really happy to share some of the insights that we've gathered through our vaccine messaging research, and more importantly, how that's been applied in the state of Illinois. Anne, do you want to introduce yourself, and maybe you can start with a description of what kicked off our partnership last year?
Sure, and thanks, Crystal. My name is CAPRARA. I'm the Chief of Staff for Illinois Governor J.B. Pritzker. I've been with him for the last 2.5 years. It feels like 15 years of his term. And very happy to talk to you today about the partnership that the state of Illinois has with Civis, and kind of why we brought them on board. Almost a year ago now, when the pandemic kind of descended upon the world and really descended upon the United States, every state government was trying to get a handle on what we could expect. And the reality is that the world community hasn't faced something this dire really in 100 years. So we didn't have a lot of experts sitting around necessarily able to tell us, what to expect in terms of the public health response and how to communicate with our citizens. And one of the first things we really needed to get a hold of it was how to model the path of the virus. And that's where we turned to Civis. We have some incredible research institutions in Illinois, and we had teams from each of those institutions putting together models on the course of the infection rate, the positivity rate, what we could expect to see in terms of hospitalizations and unfortunately deaths and mortalities as we went through the course of the pandemic. We brought Civis in really to kind of converge those models and tell us, okay, based on all the information that's out there, what is the best estimate that we have in terms of what we can expect based on what mitigations we put in place throughout the state, and really what we're going to talk about today, what we can get the average citizen to do to help mitigate the virus. That model helped shape all of our policy making here, being able to tell, when we see a certain number start to rise, what that could look at 2 or 3 weeks down the line was really critically important to trying to stay ahead of the pandemic. And it really has every step of the way been an attempt to stay ahead of the disease as it's progressed. I have both a government and a campaign background, and I will say that part of this for me was looking at when we do campaigns, how do we convince people to vote for something? How do we convince people to show up to the polls? We have to kind of apply the same logic in some senses to convincing people to wear masks, convincing people to stay inside, convincing them not to hold big holiday events. So we worked with Civis on that. Crystal's going to go through for you the kind of 3 types of research that we pulled together to lay the groundwork for our communications efforts. One of which is message testing, which basically looks at what's the most effective message that you can use. One is surveys, where it's really like polling. We're looking at different attitudes and behaviors based on what our citizens are telling us. And then for, any cash-strapped organization, and certainly state government was one of those, how do you best deploy the limited budget that you have? One of the most important things when you're doing message testing and making decisions about this is to put your own biases aside, to not approach this from, well, this is what would persuade me to do something. Usually if you're in a decision-making capacity, you may think a little bit differently than the public at large. So we needed to both identify the people we needed to reach, and we needed to understand correctly how to reach them appropriately. And so I'm going to turn it back to Crystal to talk about those research efforts and how they came together.
Thanks, Anne. So at Civis, whether the end objective of a particular campaign is to identify and engage new customers, or it's to help connect people who are eligible for government aid with that assistance, we believe that data and objective testing have to be at the heart of it all. And I think one of the reasons why this partnership has been so successful has been that the governor and folks on his team like Anne share in this philosophy and this approach. So for every campaign, we follow a 5-step approach, and that consists of, number 1, describing who the population is that you want to reach and who's in it. So how large is it? What is the demographic and geographic makeup of it? Number 2, understanding what people in this population believe, what they want, and what they need. So why are they not following precautions? Is it confusion or is it outright refusal? Number 3, testing what to say and how to say so that it's persuasive against a sample of this population. And then importantly, measuring impacts on your key outcomes. And we'll go through an example of how this played out in real life shortly. Number 4, we strive to implement through tools that are really designed with input from users. And when we say tools, these can be fully fledged and complex as custom software applications, or they can be as simple as quick dashboards. The point here is just to meet the users where they are. And then last of all, we cannot stress enough, measuring campaign effectiveness throughout the entire process is really critical so that you can make the adjustments and pivots that you need throughout. So back in the summer of 2020, we had the opportunity to work on implementing this cycle when we were helping the state understand and increase adherence to mask wearing in public. In addition to doing survey research to understand baseline measures of mask wearing and identify, are people just confused? Are they just outright resisting? What are the drivers? We help them pick the most persuasive creative. In this case, Civis conducted a randomized control trial. This is the same type of framework that's used to test drug treatments, for instance, to test different options that were drafted by the state's advertising partners. And they all conveyed the same core message, which was that, yes, it's very important. You should wear a mask when you're in public. But the reason for that importance was different from message to message. That was what made each message unique. So what we do is we take a random sample of the target population. In this case, it's a random sample of Illinois residents. Creatives can be either fully developed videos or images, or they can be early concepts described in text, or even just messaging points if you're at that stage of your process. And then the group is randomly assigned to either view one of the creatives, or they're in a control group where they see no message. Following that exposure, they're then asked a follow-up question. In this case, it's how likely were you to wear a mask? In our vaccine message testing, it's how likely are you to get vaccinated once that's available to you? And then we build and score a statistical model to help identify how persuasive what was each creative. And more importantly, were any of the creatives likely to create negative backlash, or the probability that somebody is going to be less likely to comply with what you're trying to get them to do as a result of seeing your message. So this slide shows the 5 different pieces that were tested. In this case, comparisons, which is the first one, resulted in a 3% increase in self-reported likelihood to wear a mask in public. So that was the, quote, winning message. Once we identified the most effective message, we worked with the state to integrate the insights into its media buying strategy. So what that looked like was that on a weekly basis, we updated a formula created by the state that prioritized counties by risk and then assigned a greater share of ad spend to areas with greatest need. In addition to that, the media buying campaign, some of the insights that were generated from our research and testing were incorporated into public statements made by state leadership, as well as content creation and design of things like brochures and other materials at contact tracing and testing sites, for instance. So there are widespread applications beyond the media buying as well.
And the great thing about this was that once we implemented this campaign, we were actually able to see mask wearing across Illinois increase by about 21% since the launch of this effort. And we've been incredibly lucky to see our COVID transmission rates amongst some of the lowest in the country as a result. And that told us, obviously, that our campaign here was a success. And a success that we want to build on, because we're now going to adapt a similar framework for COVID vaccine communications. You know, after doing our research, it was actually really interesting to see similarities among our previous message test results, emphasizing the personal benefits. For example, personal safety with masks and effectiveness with vaccines was very effective. In contrast, messages that talked about the community benefit, like keeping your friends and family safe or being trusted by doctors and backed by science, were likely to result in a negative backlash or causing people to be less likely to wear a mask or get vaccinated. Those results surprised me. I thought the community message actually would be particularly compelling to people. It wasn't. And I thought, talking about protecting friends and family wasn't really as effective as we wanted it to be. What really worked? Comparing a mask to a seatbelt or a football helmet. This is why we do research. And then you've got to trust that research once you find it, because this issue itself is so important, and we can't afford to fail when we're using really limited state resources to try to convince people to do something that they wouldn't normally do.
There are some key takeaways that we've gathered across all of the vaccine message testing that we've done, and we're happy to share that with all of the folks on the call. One piece in particular is a research study that we just wrapped up this week. We did in partnership with the Chamber of Commerce Foundation, who told us that employers in particular are really interested in knowing how to motivate employees to get vaccinated. So to do this, we ran a test of 5 different messages crafted in partnership with the Chamber. And we found that if an employer were to talk about how company leadership would get vaccinated once they meet eligibility requirements, of course, those were the most persuasive messages for employees. In contrast, an employer message about how a company can offer accommodations or incentives to employees, those were actually ineffective and likely to result in negative backlash. I'm happy to share all of those results and disseminate those out to the folks here, as well as answer any follow-up questions. Thank you.